At which weeks uterus height कति हुनुपर्छ र कहाँसम्म हुनुपर्छ भन्ने बारेमा आज हामी हेर्नेछौँ। सो नमस्ते नमस्कार, म सञ्जिता पण्डित आज फेरि वेलकम गर्दैछु यहाँहरूलाई मेडिकल विथ सञ्जुमा। आजको क्वेसन फ्रम 407 At 16 weeks of pregnancy, the height of the uterus is at option A, level of umbilicus, option B, midway between symphysis pubis and umbilicus, option C, इन्सिफर्म कार्टिलेज एन्ड अप्सन डी नन अफ एबभ। धेरै नै इम्पोर्टेन्ट क्वेसन रहेको छ एमसीक्यू भाइवा इन्टरभ्यू जहाँ पनि यो क्वेसन सोध्न सक्छ। द राइट एन्सर अफ दिस क्वेसन इज अप्सन बी 16 विक्स अफ प्रेग्नेन्सीमा युटरसको हाइट बिट्विन सिम्फेसिस पिभिस एन्ड अम्बिलिकसमा हुन्छ। अप्सन बी इज द राइट एन्सर। Okay, so fundal height according to weeks of pregnancy are 12 weeks ma uterus is in pelvic cavity, so not palpable हैन। under the pelvis cavities मा हुन्छ 12 weeks मा, so यो palpate हुँदैन। after 12 week यो palpate हुन्छ जब uterus symphysis pubis भन्दा माथि आउँछ, just above the symphysis pubis after 12 weeks of pregnancy। त्यसपछि at 16 weeks मा between the symphysis pubis and umbilicus मा uterus हुन्छ। त्यसपछि at 24 weeks of pregnancy मा at umbilicus मा हुन्छ। धेरैजसो क्वेसनहरुमा 12 weeks, 16 week and 24 weeks मा क्वेसन आइराखेको हुन्छ। एक्ज्याक्ट at umbilicus 24 weeks मा हुन्छ। at 30 weeks मा between the umbilicus and deep sternum मा हुन्छ र 28 weeks मा 1/3 above the umbilicus or 2/3 below the deep sternum हुन्छ। At 36 weeks मा just below the deep sternum near the subcostal arch मा हुन्छ। and after 38 to 40 weeks मा lightening हुन्छ जसमा at deep sternum बाट तलतिर चाहिँ मुभ हुन्छ युटेरस। and 40 weeks of pregnancy मा just at the level of 2 weeks मा जहाँ हुन्छ युटेरस एक्ज्याक्ट त्यही 40 weeks मा पनि हुन्छ। सो यो चाहिँ धेरै नै इम्पोर्टेन्ट छ, नोट गरेर राख्नु होला। Question number 408. The uterus has already rise out of the pelvis and is experiencing further into the abdominal area at about the option A 8th week of pregnancy, option B 10th week of pregnancy, option C 12th week of pregnancy, and option D 18th week of pregnancy. The uterus has already rise out of the pelvis and is experiencing further into the abdominal area. That means not palpable. कुन weekमा हुन्छ 12th week of pregnancy मा हुन्छ। Option C is right answer. Question number 409. Which of the following fundal heights indicate less than 12 weeks gestation when the date of LMP is unknown? त्यही भएर फन्डल हाइट बाट पनि यदि LMP फर्गेट भएको छ भने फन्डल हाइट बाट पनि EDD निकाल्न सकिन्छ। Obviously यसबाट थाहा भइहाल्छ कति विक्स भएको छ भने प्रेग्नेन्सी। सो अप्सन ए युटेरस इन द पेल्विस, अप्सन बी युटेरस एट द जिपोइड, अप्सन सी युटेरस इन द एब्डोमिन एन्ड अप्सन डी युटेरस एट द अम्बिलिकस। लेस देन 12 विक्स भनेको छ। लेस देन 12 विक्स मा कहाँ हुन्छ युटेरस इन द पेल्विस मा, यसमा पाल्पेट गर्न सकिदैन। अप्सन ए इज राइट आन्सर। Question number 410. Uterus is palpable above the symphysis at option A 14th week, option B 8th week, option C 10th week, and option D 12th week. Uterus is palpable and is above the symphysis pubis at 12th week of pregnancy. Option D is right answer. Question number 411. At 8th week of pregnancy, what is the position of fundal height? Option A below symphysis pubis, option B above symphysis pubis, option C near navel, option D above navel. 8th week of the pregnancy मा कहाँ हुन्छ fundal height below the symphysis pubis. Option A is right answer. यहाँसम्म 12 weeks सम्म under the symphysis pubis नै हुन्छ। Question number 412. The height of the uterus at the level of umbilicus during pregnancy is at option A 28 week, Option B 24 weeks, option C 18 weeks, and option D 16 weeks. At the level of umbilicus मा फन्डल हाइट कुन विकमा हुन्छ 24 विकमा ऑप्शन B is right answer. Question number 413. Level of fundus reach G-sternum at which week of pregnancy? Option A 14 week, option B 32 weeks, option C 34 weeks, and option D 36 weeks. G-sternum मा 36 weeks मा हुन्छ. Option D is right answer. अघि नै explanation गरिसकेको छु. Question number 414. At 8 weeks of gestation, uterus looks like option A small unwrapped pear, option B large orange, option C size of grapefruits, option D cricket ball. At 8 weeks of gestation, uterus look like a large orange. Option B is right answer. Question number 415. Fundal height after 24 weeks of pregnancy measured in centimeter is option A more than period of gestation, option B less than period of gestation, option C correspond to the period of gestation, and option D correspond to the period of gestation with a variable of 5 centimeter. Fundal height after 24 weeks of pregnancy measured in centimeter is correspond to the period of gestation. Option C is right answer. Question number 416. During antenatal assessment, the nurse records the following findings. A. The uterus almost fills the abdominal cavity. B. Fundus is at the tip of the xiphoid cartilage. C. Diaphragm. This finding indicate the gestational age of option A 30 weeks of pregnancy, option B 34 weeks of pregnancy, option C 36 weeks of pregnancy, and option D 38 weeks of pregnancy. दिएको फाइन्डिङहरू 36 weeks of pregnancy मा हुन्छ. Option C is right answer. Question number 417. A client above 8 weeks pregnant asked the nurse when she will be able to hear the fetal heartbeat. The nurse would respond by telling the client that the fetal heartbeat can be heard without Doppler ultrasound device when the gestation is as early as which of the following? Option A 4 weeks, option B 8 weeks, option C 15 weeks, and option D 18 weeks. नोट गर्नु होला अल्ट्रासाउन्डबाट 6 विक्समा फिटल हार्ट रेट सुन्न सकिन्छ. डोप्लरबाट 10 विक्समा फिटल हार्ट रेट सुन्न सकिन्छ. फिटोस्कोप अथवा स्टेथोस्कोपबाट 20 विक्स अफ जेस्टेसनमा फिटल हार्ट रेट सुन्न सकिन्छ. रेडियोग्राफिकबाट 16 विक्समा. एकचोटि फेरि भन्छु अल्ट्रासाउन्डबाट 6 विक्समा, डोप्लरबाट 10 विक्समा, फिटोस्कोप अथवा स्टेथोस्कोपबाट 20 विक्समा एन्ड रेडियोग्राफिकबाट 16 विक्समा फिटल हार्ट रेट सुन्न सकिन्छ. क्वेशनमा सोधेको छ डोप्लर अल्ट्रासाउन्ड. डोप्लर अल्ट्रासाउन्डबाट 10 विक्समा फिटल हार्ट रेट सुन्न सकिन्छ. तर यहाँ दिएको अप्सनमा 10 विक्स दिएको छैन. सो राइट आन्सर अप्सन बी 8 विक्स अफ जेस्टेसन. क्वेशन नम्बर 418. Fetal heart rate can be ausculted with a fetoscope as early as which of the following? Option A 15 weeks gestation, option B 30 weeks gestation, option C 28 weeks gestation, option D 20 weeks gestation. अहिले भर्खर भनेको फिटोस्कोप अथवा स्टेथोस्कोपबाट 20 weeks of gestation मा fetal heart rate चाहिँ सुन्न सकिन्छ. Option D is right answer. Question number 419. One can hear fetal heart sounds with the help of a stethoscope at how many weeks of gestation? Option A 16 weeks, option B 20 weeks, Option C 24 weeks and option D 12 weeks. स्टेथोस्कोपबाट भनेको छ स्टेथोस्कोपबाट 20 weeks of gestation fetal heart rate सुन्न सकिन्छ. Option B is right answer. Question number 420. Fetal heart sound can be detected using a pinard stethoscope between option A 16 to 18 weeks, option B 10 to 12 weeks, option C 22 to 24 weeks, and option D 14 to 16 weeks. एकचोटि फेरि एक्सप्लेनेसन गर्दैछु. अल्ट्रासाउन्डबाट 6 विक्समा, डोप्लरबाट 10 विक्समा, फिटोस्कोप अथवा स्टेथोस्कोपबाट 20 विक्समा एन्ड रेडियोग्राफिकबाट 16 विक्समा फिटल हार्ट रेट सुन्न सकिन्छ. यहाँ सोधेको छ पिनार्ड स्टेथोस्कोप. द राइट एन्सर इज अप्सन 20 विक्समा हुन्छ. तर यहाँ 20 विक्स छैन, सो बिट्विन 20 to 24 weeks of gestation. Option C is right answer. Question number 421. In which presentation the point of maximum intensity of the fetal heart sound at the level of umbilicus? Option A vertex, option B bridge, option C shoulder, and option D brawn. Bridge presentation ma option B is right answer. Question number 422. A nurse is aware that the best place to detect fetal heart sound in the first trimesters of pregnancy. Option A above the symphysis pubis, option B above the umbilicus, option C at the umbilicus, and option D below the symphysis pubis. Above the symphysis pubis, option A is right answer. Question number 423. Which laboratory test is essential during pregnancy? Option A blood group and RH factor, option B urine test for albumin and sugar, option C hemoglobin, and option D all above. These all tests is essential during pregnancy. Option D is right answer. Question number 424. The essential blood investigations to be done for pregnant women during antenatal period. Option A hemoglobin, HbS, Ag, VDRL. Option B Hb, VDRL, HIV, blood group and RH factor. Option C Hb, HbS, Ag, VDRL, HbAIC, and option D Hb, VDRL, HbAIC, and HIV. Option B Hb, VDRL, HIV, blood group and RH factor. यो सबै चाहिँ एन्टिनेटल पिरियडमा इन्भेस्टिगेसन हुन्छ. Option B is right answer. Question number 425. What is the correct about amniocentesis? Option A intrauterine diagnosis. Option B withdrawal of allantoin fluid from pregnant woman. Option C chemical analysis of fluid of pregnant woman. Option D culturing amniotic cells and a study of metaphasic chromosomes to identify chromosomal abnormality. Option B is right answer. Next question in next video. Thank you so much.